So, as I've been researching and reading, I know there's a lot of terms that come up that are you're not familiar with or you don't know exactly what they mean. So, I thought maybe I could explain some of the terms to make it easier. First off, I'm having a Mastopexy. You'll hear that word a lot. It's just a medical term that means breast lift. A lift reshapes and repositions existing tissue. It does not add volume. That's what the implants do. This matters because lift recovery often feels tighter and more restrictive than augmentation alone. Different procedures, different healing experiences. Profile. That's what the surgeon calls when he's describing how far the implants will stick out. So it's not about size, it's about how high they are. They're low, moderate, and high. So that's how far out it's going to stick from your chest. Base width. So this is a big one that I didn't understand before I went in. It's the most important measurement when it comes to breast surgery. It's the width of your natural breast footprint. It determines which implant will actually fit your body. So I am 5'10". I weigh about 165 pounds, and I'm a bigger girl. And I had naturally like large breasts to start off with when I was younger. I was a 36 double D before I ever had kids. So I have a wide base width, and they have to match that with the implant. Otherwise, it'll look like it's stuck a small mound in the middle of a large base, if that makes sense. Under the muscle. So under the muscle placement means that the implant is partially underneath the chest muscle. Early on, it can feel tight and sore and restrictive, especially when using your arms. The discomfort is expected and temporary. Muscle healing takes time. It does look a little different in the end if you have under the muscle versus over the muscle. Like, I want mine to look more natural. I'm not going for looking like I have a lift and breast implants. I want it to just look like I should have looked by nature, but if you get them on top of the muscle, a lot of times they will look more pronounced and more like breast implants. High and tight, another term that you come across. High and tight is the early post-op look. It doesn't mean anything's wrong. The swelling, the muscle tension, internal sutures all push things upward at first. It's normal. It passes. You will not look like Barbie the whole time. Drop and fluff. Drop and fluff isn't something that happens overnight. It is the result that you're going for. It's a gradual process where the swelling decreases and the tissue relaxes over weeks to months. This does not happen symmetrically. One always goes before the other one. So even if you're not symmetric early, you will be eventually. Capsulation formation. So your body forms a scar tissue around the implant. That's called the capsule. It's not a complication. It is a normal protective response that your body does. Problems only happen if the tissue becomes tight or painful, which is uncommon. Capsule formation is part of the normal healing process. So surgical bras. Surgical bra isn't about how it looks. It provides compression and support and swelling control while the tissue heals. Comfort comes later. Functionality comes first. It's temporary, even if it feels awkward. Most of the ones that I've seen and what I got was a front fasten one because I'm not going to be able to reach behind my back. It is the ones that I bought are very adjustable. They have straps that you can adjust to make it tighter or looser, and it has a zipper in the front with a bit of fabric behind it so that the zipper doesn't touch your skin. And it also has almost what looks like the fasteners for a regular bra in the front to help hold it together while you're trying to zip it. Okay, scar maturation. Scars don't look final at a few weeks or even at a few months. Scar maturation can take up to a year. Early scars are often red, raised, or uneven. That does not predict the final results. Time matters here. Your surgeon should tell you if there's any kind of scar treatment that they recommend and when to start doing it, because you do have to wait for it to be closed before you start any kind of treatment on the scars. Post-op emotional dip. Many people experience an emotional dip after surgery, especially if you have a pre-existing mental health issue like depression, anxiety. The anesthesia is going to maybe make you tearful or moody. So forewarn anybody that's going to be there with you that you don't mean it when you snap on them after you get home. After anesthesia, swelling, fatigue, vulnerability, it's normal for you to be a little emotional. It doesn't mean that it's a bad outcome. It doesn't mean you regret your decision. It's just part of the recovery process, and it will pass. That's enough terms for now. Check back with me.